Hello, I'm Paul Baker, developer of the ORSIM Bronchoscopy Simulator. And today I'm going to cover some aspects of our pediatric module with you. So to do that, I'm going to share the screen and start the simulation. On screen here, you can see ORSIM Freestyle and ORSIM Lab. And I'm going to start ORSIM Freestyle, and in the bottom left corner are pediatric upper airway disorders. And today we're going to talk about the foreign body. Now, this is an interesting case of a child that was walking with a pencil in their mouth. They fell forward and the pencil point was impinged in the posterior pharyngeal wall. So this immediately poses airway difficulties, because you can see to get a face mask seal with a pencil would be very difficult. To place a supraglottic airway would be difficult, and laryngoscopy by direct or even video laryngoscopy would be difficult with that pencil in place. And we don't want to remove that pencil till we have surgeons available because of the risk of significant bleeding. So to maintain oxygenation, we've got nasal prongs. Now there are a couple of important points I want to raise with you to start. First of all, the two basic principles are to maintain oxygenation and avoid trauma. Oxygenation in this case will be with high flow nasal oxygen, and you can see they're already in place, but I have removed the right hand prong in the expectation that possibly we'll have to do a nasal intubation. So to turn on oxygen, I can click in the upper right corner, and that also activates the pulse oximeter. To avoid trauma, we have already discussed the options of airway management, but I'm going to use the flexible bronchoscope for intubation. And this is, in my view, probably the ideal instrument because it's small, it's very versatile and mobile. You can navigate easily, and it's relatively atraumatic. This child would have been anesthetized with total intravenous anesthesia, and also local anesthetic has been sprayed with an aerosol technique. So I'm going to start with an oral intubation. I'm going to gently move the bronchoscope down beside the pencil towards the posterior pharyngeal wall. And already there's an interesting piece of anatomy there. That's the uvula, which tends to point towards the larynx. So that's a midline structure. I'm going to go slightly lateral, and you can see anteriorly there's the tongue enveloping the foreign body on both sides. So we move towards the posterior pharyngeal wall. We're going slightly lateral, but I'm going to move back towards the midline, past the tongue, and there's the epiglottis. And beyond that, we can see coming into view. I'll just realign that. But there's the arytenoids, and beyond that, I should find the vocal cords. There's the anterior commissure just behind the vocal cords. So through there, I'm going to adjust the tip angle on the bronchoscope by pushing the lever of the bronchoscope up. This model is animated, so we can see vocal cord movement, and we're into the child's trachea. So that's an oral intubation, and at that point I can place a tracheal tube and remove the bronchoscope. Now, if that had failed, then I need to go to my plan B, which in this case is a nasal intubation. So I'm going to move the tip of the bronchoscope either using the button. And you can see the tip of the bronchoscope is now moving towards that right nostril, or I could use the arrow in the top left corner. There's a little arrow, and I can do the same thing there by clicking on that with the mouse. So for nasal intubation, I choose the widest entry point of the nose, and that's the floor of the nose with the inferior turbinate above. And I'm going to do this very gently. I don't want to start any bleeding. Working my way through the nose. There is the inferior turbinate above that. And now into the nasopharynx, and there is the foreign body, and beside it the tongue. Down below the tongue, working my way forward along the edge of the and there's the larynx. So there's the arytenoids, a nice anterior view of where I want to be. Gently moving forward over the top of the arytenoids. Just align the bronchoscope with a bit of rotation. Now push the lever up on the bronchoscope. Once those cords open, I'm going to move into the trachea, and that's the nasal intubation. And again, at this point, I have a preloaded tracheal tube and I'd intubate the patient. Everything I did during both performances was being recorded, and potentially I could play that back as part of my training exercise.